Okay. All right. Can you hear okay? All right.
Yes.
So for my panel speakers, just know we got to have this really, really close right here. Anyway, I want to say hello to everyone and welcome to our February 23rd, 2023 meeting. And we are delighted that you guys are all here. This is wonderful. Thank you. Thank you. This is going to be a great meeting. And what I'm going to do, I'm going to go straight to the PowerPoint now. You've got it. Share screen. Okay, there we go. Let me. I'm just the screen so the people here can see everything. Okay, this is the GAPS hybrid meeting. So you saw a minute ago, we have a Zoom crowd that's following us. And they're from all over, and that's wonderful. Also, this meeting will be recorded in just a few minutes. So you'll hear the recording on if it hasn't already started. I have Deb, who is at her home, who is helping me monitor this. As you can see, and especially for some of you guys that came early, there's a whole lot of stuff going on. We're trying to operate several cameras, as well as to make sure everybody can hear okay. So we'll just move right along. I think you guys all know me, that I'm Mary Jane. And my husband, Dave, and our dog, Jenny, is giving out door prize tickets. So if you did not get a door prize ticket, be sure you get one. And by the way, if he promised you a boat or car, we don't have that, but he tries to, he tries to tell everybody that, I tell you. Okay, this is our agenda for today. I think our Zoom crowd is seeing it okay, and hopefully you guys are seeing it all right. Of course, we always have a social hour. As you know, with our mantra is to exercise, or educate, exercise, and socialize. So this is part of the socialization by coming at 2:30, and we start promptly at 3 o'clock. I want to be sure and not only welcome you, share some announcements that I have on the slide, but also, as you notice around the room, we have our sponsors. Now, Patty and I are going to have to talk to some of our sponsors. We've got them set up, but they didn't make it. So I don't know what all's going on. But our speaker sponsors definitely made it and brought some goodies. So check that out. And then we're very, very fortunate. I know many of you guys have heard about Power for Parkinson's. We have a representative from Power for Parkinson's is here that will be talking to us and hopefully leading us in just a few exercises. Okay, this is our first sponsor, which is Supernus. And they have Apican and Gocovri, so they have a lot of meds. But if you're on any of these meds, and if you ever want to know information about it and you want to speak to the rep, let me know and I can connect you. Another sponsor, of course, is Medtronic, of which we have Mr. Medtronic. David Ott is here. So if you have any questions on Medtronic on the DBS unit, please go over and speak to him. We also have Abbott as a sponsor. That's Donnie and Damon. And I guess something must have come up. Of course, these fellows are busy working and something may have come up. And then we have Accorda. Accorda brings Arguijo. Arguijo is that off medication where we inhale it. So remember, if you ever have questions on that, and we have access to the sponsors. Then we have Arcadia. Arcadia has the medication that's called Nuplacid, which is what you take often if you are having hallucinations or delusions. Now, you get a plus on this one because we are going to have something very new. This is the first time for GAPS to do this. We're going to have an educational luncheon. It's going to be at the Georgetown Public Library, and it will be, as you can see right here, on Friday, March the 10th. It will be free, and it will be a lunch. So if you would like to learn more about Nuplacid, or if you think you've ever experienced hallucinations or delusions, this is a great time because they'll either have a doctor or a representative from the company that will actually share this with you. Now, many of you guys, I hope you got your handout. I did a handout for this meeting, and on the back of the handout is information right here and how to register. You do have to register for that. And I believe I saw Anita here just a moment ago. There she is, standing. Anita, so everybody can see you. Anita is my liaison to help with this. And if you have any questions, her name is right down here as her email. Or you can certainly ask her right now, but it should be nice. We did just learn, though, the elevator is not working. So They have some stairs to go upstairs. That's going to be the downside. They hope they'd have it ready, but they're not promising anything. So just keep that in mind if you do want to go to this thing. Thank you, Anita, for all your help and all your work with it. All righty. And then I wanted to let you know that we do have a caregiver support group. It's on the second Thursday of the month from 2 to 3:30. We meet here in the education building of the church. It's just right down that hallway. And actually, you wouldn't think caregiving would be a fun group to go to, but we do there's a lot of laughter, a lot of fun, and just a lot of sharing. I think we average between 15 and 20 people at our caregivers meeting. So they are good. We have another caregiver group that's really, really good. And I need to be sure to put this on the thing. Tama, if you'll stand up. Tama also leads a caregiver group, and it's at Crestview Baptist Church. Wonderful group. And y'all meet on Mondays, I believe, right? Third Monday of the month at 1 o'clock. And that's another caregiver group. So just keep that in mind that we're very, very fortunate to have all of this. We also have a DBS support group. It's been on hold, but it is planning to start back up in April. And guess what? Dr. Swallow is going to be the speaker. And what's extra nice about that is many times you have a difficult time trying to get to see Dr. Swallow because of his schedule and being so busy. But this is a perfect time to come to a meeting, especially if you've had DBS or considering it, that you can talk to Dr. Swallow one-on-one in a great opportunity. So keep that in mind. That's coming up on April. Do we know the date? Well, anyway, believe me, it'll be in my newsletter. Does anybody read my newsletter? Oh, look at that. Yeah. I had all the people raising their hands. So it'll be in the newsletter and all my emails. Okay. And again, this is the mantra that we come up with and we try to follow it. You know, a lot of people, they're very hesitant coming to a support group because they go, oh, they're so depressing. They're so, down. And ours, they're very focused on education, very positive, living your best possible life with Parkinson's. And that is our goal. I get a lot of phone calls. If anybody ever has questions, I got a phone call this morning on ramps. They just want to know a little bit more about ramps. But if you ever have a question on anything that you need some research done, well, call me. I'll get on it. But before we get into our speakers, I want to tell you about this exercise. And by exercise, I want to go to our Zoom person. So Elva, get ready. I'll be coming to you very soon. But making joyful noise. Every Monday we have a music therapy group, and we actually now have a speech therapist. JD Bush is our speech therapist. And on the second and fourth Monday, JD will be there and will do a full hour of vocal exercise. It's wonderful. We encourage you to come. On the other Mondays, the first, third, and fifth, we sing. Now, believe me, that's where the joyful noise comes in, because none of us can sing. And I certainly can't. You ought to hear me try to lead it. But we have that's a lot of laughter, a lot of fun too. But anyway, please keep that in mind if you'd like to come for vocal exercise. But in addition to that, we have officially started, and we are now having free chair yoga. Both vocal exercise is free, chair yoga is free. Vocal exercise meets here at the church, again, in the same room with the DBS and caregivers.
I could do that.
The chair yoga meets across the street at the Church of Christ. And it's right there in the big atrium opening, just going into the sanctuary. It's very nice. We're getting a lot of really positive comments. So if you would like to go to a free chair yoga class that is at 11:30 on Wednesdays, we would just welcome you totally. And okay, ping pong, guess what? We got Don. Don, will you stand up if you don't mind? Don Kerber is our liaison for ping pong. Well, he's still raise his hand, but anyway, he's back there in the back row. If you think you'd like to play ping pong, and I know some of you guys are reluctant, you'll say, hey, I can't do ping pong, I might fall. Well, we understand that, but there are still some aspects of it that maybe you can do. It's actually becoming very, very popular for Parkinson's. So if you would like to talk to Don, please do. Also, you can go again on my newsletter and on our webpage where we talk about ping pong. There's some videos. So consider that, give Don a call, because if we get enough people, we're actually going to reserve a room for ping pong. Okay, moving right along. We've got our speakers, but before our speakers come and we're still in the exercise mode, I'd like to introduce you to a individual from San Antonio, Texas. I'm going to do a stop share at this point. Okay, and I believe, Deb, you're going to spotlight Elva, please. Let's see. There she is. Excellent, excellent. Okay, this is Elva. In our big room here, we have you on a big screen. Elva is from San Antonio, and she would like to make an announcement. Please do.
Good afternoon. Can you hear me well enough?
We hear you very good.
Wonderful. Good afternoon, everyone. I'm here to invite you to a moving day, San Antonio. It is a walk for Parkinson's for the Parkinson Foundation. It's a fundraiser for them. It'll be on Saturday, April the 1st from 9 o'clock till activity begin at 9 o'clock with different vendors here. A lot of freebies similar to the layout that you have there, Mary Jane. And we want to kick off April being Parkinson's Awareness Month. Our mayor is going to be here as well to read a proclamation. And we walk for Parkinson's and we fundraise for them. We need a team for our walk. So I welcome you and I invite you to come walk with us. I know you're in a different city, but it's all for Texas, not just San Antonio. So you can benefit from different educational programs that they provide for us and other items that they do. You can walk as far as you want to. We'll be walking in a track at the Incarnate Word, University of the Incarnate Word here in San Antonio. And I'd like for you to join us, create a team or join our team that I have. I have a team called Team Sloth. Whichever you'd like to do. We would like for you to especially join us with a team. I gave Mary Jane, I sent you a flyer. So if you want to show that later or pass it out to everyone, there's information on how to join. And if you need help to join or you create a team, you can call me and I can help you out with that.
We'll consider it done for sure. We will have it in our newsletter and it'll be on our emails. And we already have it on our website. And we have a cycling event also that this is for the Parkinson Foundation. And they're also doing a cycling event that'll be in Austin. So all of this is on our website to let you know. But thank you, Elva, coming all the way from San Antonio. So see, we do have, we've got folks that follow us. We even have people following us internationally. So I'm just kind of blown away. But they don't come up on Zoom, but they'll watch the videos later. All right. Thank you, Deb. Again, thank you, Elva, very, very much.
Thank you.
Let's see. Now, Deb will go on and I'll come back to my PowerPoint. There we go. Okay. Okay, this is my PowerPoint right here that I wanted to be sure and share with you guys. And it's going to be our speakers. So we get our speakers. If you're willing to come on up, we're going to actually put them on the big stage right up here. Y'all can come up the stairs right here. I'll kind of introduce you a little bit, but I want you to tell more about yourself when you're up here. But we have Stacy Scarborough. Now we're very, very fortunate that GAPS is now a nonprofit, and our nonprofit, we have the board, and Stacy is our board rep for communications. So we're really, really lucky to have her. She's going to be the MC of this to talk to everyone. We have Amy and we also have Keith, and they're going to be talking. They are from Inhabit. And then we have Sarah, and many of you guys know Sarah because y'all have met her before in these meetings as well as in the caregiver meetings. So while they are setting up real quick, we are, I want to be sure to share something else with you. Elva mentioned April as being Parkinson Awareness Month, and that is certainly true. And I have already received word officially that 2 representatives from the Michael J. Fox Foundation will be here. We used to have them come all the time. Not Michael, he does not travel and come down here, but their reps are going to be here. But prior to COVID, they didn't. We just got them from New York. It was kind of interesting. Now, if any of y'all were with us when we had them in New York, it was really kind of interesting learning about that. That was all during the COVID mess. But we will have 2 reps here in April. We're also trying to be doing a lot quite a few more things in April, so you better read that newsletter. I got a lot of stuff in it, I tell you. Okay, now what I'm gonna do, I'm gonna do a stop share. And Stan is my man. I want y'all to all meet Stan here. I'm gonna turn this to him. Stan, there he is, yes. He
You
helps
have the
me.
microphone.
Yeah, I'm gonna give him a microphone here. They're gonna pass this one down, but let's move this table down, Stan, so you don't have to hold the thing.
We got the
And,
microphone. too.
so that way you get to see all the speakers. Okay, Stan, if you'll put the camera right here.
Oh, okay.
Let's see how we're doing here on this thing. This is, oh, look at that. So y'all get to see them there and the Zoom crowd gets to see them. Okay, I'm gonna give this one to Stacy.
Hi, everyone. Can you hear me okay? Right. So this is our team here. Mary Jane, you introduced everyone
Yeah,
a little bit, but I'm gonna have each one, before they speak, tell you a little bit about their background and why they are here and who they are. So we've just broken up into, different categories. So I am here to represent the home care industry. And you have Sarah with senior living.
Yeah, okay, I'm with you.
You have Amy with home health and Heath with hospice. So we are here to just discuss kind of some key questions we often find that we get, some misconceptions, some, good old facts. But then please feel free at the end. We're happy to answer your questions if there's extra time. So we're just going to go down the line kind of as a panel. I'm going to ask them some questions that they've sent in to me that they often find themselves answering, and we're happy to clarify anything at the end. So for me, I know I've spoken to this group before about visiting angels and home care. So today I really wanted to clarify and focus on the VA benefits with home care. There are some wonderful options right now. The VA is handing out more hours than they typically have been in the past, so it can be a little easier to get home care paid for by the VA. One way would be through the home health aid and respite program, which is through the VA healthcare system. So if you are a veteran yourself or your loved one is a veteran, they already see a VA doctor, that's as easy as it gets. You go to that VA doctor, tell them about your needs, whether it's I need respite care, so I need a break, I'm the caretaker, I need some help, can I get some hours paid for through the VA for respite care? And that doctor, that VA doctor can write an order for that for a certain amount of hours. Or maybe your needs are more on the personal care assistance. Loved one or yourself needs more help with taking a shower, getting dressed, hygiene and grooming. So you need more help with your activities of daily living. That's another benefit that the VA can write an order for a certain amount of hours to get paid for through a home care agency. Or maybe you want both. You could get the respite hours and the home health aid hours through that VA doctor if you express that need. If they do determine you're eligible, I'm going to write an order for it. Then they're going to give you a list of home care providers that have that VA contract. And then you just pick which provider you want to use for those hours. If you don't already see a VA physician, if you're not enrolled in the VA healthcare system, that's okay. You can actually do that online or over the phone. Enroll in the VA healthcare system so that they can assign you with the VA doctor to get an order for that program. You don't have to drop your other doctors. You don't have to see them for other things. But that way they can assign you with a VA doctor to get you into those programs. So I have really detailed information over on the Visiting Angels table. There's great information on the website, or call us and we're happy to kind of go over some of those options, but I wanted to make sure you knew about it or you could share it with people you know that might be able to benefit from that. So that's my little home care tidbit today. All right, so I'm going to go on to senior living with Sarah. Sarah, will you first just kind of tell us about yourself? Oh, there was one.
So, is it live? Awesome. I'm Sarah. I am the owner of Senior Living Advisors of Austin, yet I told someone earlier, it always throws me when someone says the name of our company, because senior living is only a little small portion of what we do. Think of me as an elder care consultant, a dementia educator, and what you may be thinking is, well, my person doesn't have dementia. I get that a lot. We have a diagnosis of Parkinson's, but there are so many things that come with Parkinson's, and where I work most with folks with Parkinson's are the non-motor symptoms. And a lot of that does involve mood dysfunction and cognitive changes that we're seeing. So I do a tremendous amount of education. I will come and walk alongside you with whatever you need to plan care through end of life, what that looks like. So we do senior living, we do advanced care planning, we do a lot of private consulting. Do you need me to work one-to-one with you on what this looks like for our person that we're caring with? I say caring with because this is a partnership. And then we also do a tremendous amount of caregiver support. So I am a part of the Parkinson's and Movement Disorders Alliance, as well as the Lewy Body Dementia Association. So you may also be saying, my person doesn't have Lewy body. Well, it falls under this entire umbrella of what we call dementia with Lewy bodies, Parkinson's disease dementia, and multiple cortical atrophy. So as an educator for the Lewy Body Dementia Association and as the facilitator, I guide all of our support groups, not only for care partners, but we also have a very unique dyad group for diagnosed individuals and their care partner. So they have a group of their own, and then we discuss the same topic. We get back together and figure out how we can best care with each other.
Thank you. I'm gonna stay on you, Sarah, for now.
Okay.
So now that we know that we can kind of trust what she has to say, right? Sounds like she knows what she's talking about.
It sounds good, doesn't it?
Okay, so number one, when is the right time to consider looking for senior living community? How do I know? Do I kind of start now? Is it too early? Is it too late? I don't even know where to begin.
Great question. I tell care partners an awful lot, look before you think you need it. And that's not so you can line it up, make the move sooner rather than later. It's simply that you know what's out there. We have made the decision early on, we will at least consider it. You know what's out there, and this is not your grandparents' old folks' home. A lot has happened in the last 15, 20, 30 years in senior living. Especially in our dementia care communities. We are so much better trained and educated and prepared to work with folks. So what happens if we end up in the hospital? We go to rehab. Oh my word, I can't go home for some reason. We can either go home with home care, home health, or hospice. We can also go to senior living with home care, with home health, and with hospice. So it's kind of where do we want that 24/7 care to come from? Is it one of these great folks? Is it we need to be in a 24/7 community that can provide that support around us? So look before you think you need it. We have in our mind what we may be looking for and what may be a good fit. So if we are in that position, we're not scrambling in an emergency to say, oh my word, now where do I start? At least have it in your mind.
Absolutely. I always recommend kind of having those places you have in mind too, written down in a little folder or binder, right? So someone could easily find it for you if you're not able to. At least your loved one knows where it might be located, and you already kind of did some preliminary research on costs and some of your favorites and location and that thing. Okay, so if you decide, right, I think I am maybe ready for this. I'm starting to look around. How do I even choose what's right itself? There's so many different kinds. How do I know what's right for me?
Yeah. We could do a Google search. Did I say Google? Google.
That's like off brain.
What did we got? We could do a Google search, pull up every community in town and just start visiting. Is that best use of your time and efforts? What do we even ask? Have we ever looked at something like this before, or are we at the mercy of the salesperson? I'd rather go in a little bit more prepared than that. So what we can do, if you choose to engage our service, we'll have a great conversation ahead of time. We will know what we're looking for, and then we'll go look at it. So we use your time wisely. Not every senior living community is created equally. Let me say that again. They're not created equally. And what may be pretty real estate, we're really looking at care. For my families, typically care is number one. Parkinson's is a consideration. Are they going to give my person their medication at 8, 12, 4, at 8? By state law, they have the ability to give that medication an hour prior to 8, 12, 4, and 8, and an hour after. So what happens if you get up late, you don't get your dose of dopa until 9? And what happens if you're first on the list, they come back before lunch at 11? How does that work? Right. So we need to make sure that we're looking at the right options. They work with folks with Parkinson's really, really well. They know what they're doing and they know what they're looking for. So we could stab in the dark, or we could have someone help you walk through that process.
And I also like to recommend, if you're gonna go tour, whether you're with someone that can help you, that is a professional, or you're going on your own, or you're popping in, or you have a scheduled tour, try to also go the off times, right? Like on the weekend, in the evenings, 5 o'clock, not when it's always perfect, fully staffed, bright and shiny, and everyone's got their best game on, right? You want to see a little behind the curtain too.
Recommendation, you schedule the first one, you get the entire, for lack of a better term, dog and pony show. Second one, drop by. Hey, I was driving down the street, I really want to look at that room again, can I measure it? Get you back through the door. Maybe this time you talk to the receptionist and not the salesperson. You get to see the community in an off time. Schedule the first, pop by on the second.
Can you maybe kind of go through the different options in senior living, just like the different categories? You know, you got your independent living and so on.
Yeah. Senior living is not just assisted living and dementia care. A lot of folks choose not to have home ownership anymore. We don't want to mow the lawn. We don't want to, after the recent storm, pick up all those branches out of the yard, or pay someone to do that. So a lot of folks will enter into what we consider 55 plus, or maybe independent living, travel, just have it be their home base. Really, when we're beginning to talk about care, the people that do hands-on, and whether that's 24/7 or not, we're looking at assisted living or dementia care. So 55 plus is an apartment. Everybody has to be 55 or above, or have a partner that is 55 or above. When we move into independent living, that is also an apartment. Everybody's above 55, but they also include meals, housekeeping, transportation, all of your utilities, and an entire social calendar, but no care. When we step one step further, we're talking about assisted living. We have two kind of categories. We have a type A and we have a type B. Type A is what we consider assisted living light. So in essence, think about it this way. If you press your button in the middle of the day, care is going to come to you. If you press the button in the middle of the night, there is no awake and ready to assist staff. So if that's where you are, maybe a good fit. But if you want the reassurance of 24/7, if you ever push that button to have someone come and assist, you really want assisted living type B. And then dementia care is assisted living. It is assisted living that helps not only physically, but cognitively. So they are licensed both as an assisted living type B as well. But for dementia care, what we typically call memory care, I personally think it's a misnomer in the market. I like to call it dementia care or dementia support is really what we're offering. They are going to be better trained and they must have a certification as a dementia care community. If they are calling themselves a dementia care community and they do not have that certified Alzheimer's license, they are not properly licensed.
So what would be the typical price range of an assisted living memory care? I hear it's so expensive. I don't know if I can afford that. How does it work?
Yeah. We can 55 plus, you're talking anywhere from 1,200 to 2,200. When we move into independent living, we're looking at more like 2,500 to upwards of 6,000, depends on how fancy. If you want the Taj Mahal, as opposed to a really homey little community. When we look at assisted living, what's going to drive your cost are two separate things. Your room rate, which is room, utilities, meals, all of that involved. Then you've got a level of care on top of that. So those two things make up your total cost. We can, on the low end, get 3,800, but remember, all care is included in that, upwards of 10,000, depending on how fancy that you want to get. And then when we start looking at dementia care, we can get in the ballpark of communities offering specials, 3,800. I will say in my experience, I do mainly dementia care. Really where that bar lies on the low end is about 500 for a good, 5,000 for a good quality community, upwards to 10 or 12,000. Depends on everything that's involved in that. But we want to find the right fit for you. So it really depends. And we need to come with a good budget. You tell me, hey, we're comfortable spending this much. We're not above this amount. And we're going to use those parameters to find the best fit.
What availability are you finding in like assisted livings and memory cares right now in like Williamson County? How easy is it to get into one? How quickly?
Well, I will say Georgetown cannot build them fast enough. We're in that mode. There are some great communities in Georgetown. There really are. As we build brand new properties, a lot of our folks want the new, brand new and shiny. So they're moving every time a new one opens, they're moving to the newest and the newest and the newest. So we are seeing some wait lists, especially here in Georgetown. There are a few that are opening quickly. There's a couple in construction ready to be to put an agreement on and ready to move in when they're open. Think of it this way, just because it has a wait list doesn't mean it's the best. And just because the best could have openings. Think of it that way. So really what we want to do is find the right fit. And depending on our time frame, if we have time to wait, great, get on that wait list. If you need something sooner, we look at other options. There are really great options, Round Rock, Cedar Park, just depends on where you want to be.
All right, last question for you. So if I know I want to be in an assisted living or senior community somewhere, what other outside support am I allowed to bring in? Can I have home care, home health, hospice? Or do I have to use their people? How does that work?
Great question. Yes, on all of these people, talk to them. You can be in a senior living community and still need, let's say, one-to-one care for your person. Let's say afternoons or evenings are the worst. And we really need that one-to-one care. You can be in a senior living community and still have home care with visiting angels. I recommend the second you know you're moving to a senior living community, you get home health on board. That OT is doing a home safety evaluation to make sure it's safe. We've got speech on board just to make sure cognition is still good and we know how to maneuver our community. We've got physical therapy, getting you up and down the hallways, strengthening and conditioning. We've got all those folks on board and you've got a nurse overseeing. At a certain point in time, whether you're home or whether you're in a senior living community, you can have hospice. Hospice is not a place necessarily. Hospice is a service, a great service. And have a discussion with this man before you think you need it.
Thank you. Okay, that's going to conclude our senior living questions for now, but we'll hold other questions to the end. That kind of go out. Can you hear me?
Yeah.
Okay, it kind of went out, right? Hello? Is that better? Okay. All right, so Amy with home health. Just kind of describe what even is home health. What does that mean?
So home health is where we come into your home to provide a service to you, because it is difficult for you to get out. It is difficult for you to get out into the community, to either go to an outpatient or to get to your doctor's offices or anything like that. So we provide 4 different types of services, all therapies, it's physical therapy, occupational therapy, speech therapy, and our skilled nurses. So we come and do the treatments in the home, so you don't have to go anywhere.
So does home health, can I just like have my therapist also like cook me a quick meal before they leave or like throw laundry?
While some of our therapists would probably love to do that for you because they do get very attached to their patients. We are not allowed to do that. So we do run under Medicare guidelines. Home health was built for Medicare patients. So we have a lot of rules to follow. Every service that we provide has to be a clinical service. So you have to have a skilled need for us to go out there. So we are unfortunately not allowed to do errands or laundry or household chores. But we can educate you and show you how to do said things safely. Say you're having trouble getting into your bathtub because it has a high step over and you feel really unsafe doing showers, but you can do the actual shower. Our occupational therapist can recommend devices to put into the shower so that you can take your shower safely. Our therapist can work on strengthening, so stepping into the tub isn't as difficult. So we can assist with any of the fun things in the home. We just can't perform those duties for you.
Thank you. Yeah, so that's when you would then need a home care agency as well. We see many of the same patients. Many of our people are going to have home health for your skilled therapy help in the home. And then you may also have a home care agency to pick up where the home health cannot do those daily living tasks. So you might have a caregiver as well as a physical therapist coming in. And that's very typical and normal, or a good duo, right? Okay, so how does someone get, they think they could benefit from it? Maybe they've seen a change, a decline, an injury. How do they get it?
So there's a lot of different ways. Sometimes patients go into a hospital and then they'll have a case manager who will send a referral to a home health agency. And then that's how we get started. The other way is through your doctor. So if you are having falls, you're seeing more difficulty in the home, you can let your doctor, whether it's a specialist like Dr. Swallow or Dr. Eisler or just your PCP, you can say, hey, I really think I need a little extra help. I'm having some difficulty. And that doctor will send over an order. When they send over an order, we go through our own process, we contact you, we get it all set up. And that's how we get going. But also you can always just call our branch. And you can say, hey, I need some help. I don't know what to do. We will get all the information from you. We will reach out to your doctor for you. And we will get everything we need that way. But we do have to have a doctor who agrees to follow your care. So we are reporting back to a physician and letting them know what we're doing in the home. So that way your doctor's also updated on how you're doing, what progress you're making, and what other help you may need.
And who pays for that?
So home health is largely covered by insurance. Again, it was meant for Medicare beneficiaries. So Medicare is covered 100%. Each home health is different. I'm speaking for Inhabit Home Health, but every home health in the area takes different insurances. So if you have another group that you love, that you trust, obviously you would go through them, but each individual company would run your insurance. Personally, with Inhabit, we don't like our patients to pay for anything. So if there is a random copay, we would let you know prior to signing you on for services, because we don't want unexpected costs for you. But if you have Medicare or if you have a VA benefit, covered 100% for you guys.
Awesome.
Yeah. That's perfect.
So how many visits can you typically provide a patient?
So it all depends on the need of the patient. We always have an evaluating clinician go out first. So they would go out, running through a series of different exercises and questions and figure out what type of. So generally, if you're getting a therapy, it's anywhere from 2 to 3 times a week. Now, we do have patients who are in day programs or who have multiple doctor visits, and they are very busy people. And so sometimes they're like, hey, I don't have the energy to see you more than once a week. And that's okay too. It is a conversation between you and our clinicians, because you are an active participant in your care. So we don't do anything without you okaying it and you saying yes. So typical is 2 to 3 times a week until we can meet goals. But again, if you think that's too much or too little, that can be a discussion. And we keep you on services as long as we are making improvements and working towards your goal. With Parkinson's, it's a progressive disease. And so obviously our goals might be a little bit more long-term. But a lot of our patients, just have a quick fall and then they just need a little something to get them back up on their feet. We might see you for just 2 to 3 weeks, and then you're feeling great, you're doing great, and we don't see you again until the next time something happens and you need us. So everything is case by case and based off the patient, the doctor's wants, and also what our clinicians think.
Thank you. I feel like this is still muffled. Yeah, here, right? Still green. It just kind of goes to sleep, I think, maybe. So how do I know if it's appropriate for home health to get my physical therapy versus going to outpatient therapy?
So to be qualified for home health services too, we do have to consider our patients to be quote unquote homebound. So there's a couple, again, we follow Medicare guidelines, lots of rules, but they basically, if it is taxing, takes you a little extra time to get out and about, to get to the car, to walk down the driveway, to get in and out of doctor's offices. Any type of taxing effort for you is a good indicator that you're appropriate for home health and would be approved versus having to go to an outpatient clinic. Outpatient means you have to drive there, you have to sit in the waiting room, have to participate, and you have to drive home. With home health, we're coming to your door. A lot of our patients just have it unlocked and our clinicians will be like, hey, here I am. And they come in. So you don't even have to get up to open the door. But any type of new diagnoses, any type of new equipment that you're using, say you just started using a walker or you just got on a cane and you're fumbling with it all the time. Also solid indicators, you could use some assistance at home. So there's a lot of different qualifying pieces, but generally if it is difficult and taxing for you to get around, or you just need a little extra time to do so, that would be a solid indicator to come to us versus going to any type of outpatient clinic. Our goal is to get you strong enough to be able to do those outpatient clinics comfortably.
Okay, and what if I had home health before? Now I think I want it again, but I really wasn't crazy about my first experience. Do I have to go with the same one? Do I have to pick the one my physician recommends? What can I do?
You have complete choice in your care. It is patient choice on who they want to use and who they want coming into their home. We would love it always if you chose to have it home health. But we understand that not all experiences are 100%, and that sometimes personalities clash. I personally tell my patients when I set them up, if they have any issues whatsoever, to give me a call, because switching out a therapist and saying, hey, personalities just aren't matching, super easy to do. We can send somebody else to the home. But if it's just a total experience letdown, you can choose whatever agency you want to use, as long as they're taking your insurance, and your doctor approves it. So you do not have to go with the doctor's recommendation. You do not have to go with someone you used prior. You can swap services. You just can't be on 2 services at the same time.
Can you help with family training on some of these skills you got?
Oh, yes, we can. So. But our clinicians are super great at training for any caregivers or family in the home. Sometimes when I talk to patients, their family will jump on the phone and say, hey, this is something I really need to learn. And we just make a note of that in the patient's chart. Clinicians are great. But we have this beautiful book. It's a caregiver handbook. This is a program that our clinicians can read. So if you got sent to us for a recent fall due to Parkinson's diagnosis, they're gonna come to you with this book, which is a fall prevention handbook for the patient to go through. But if we know that there's a caregiver at home who's also struggling and wants to know some things and wants to keep themselves safe so they can continue to care for their loved one, we have this. So these are very interactive books. They're written at 5th grade reading levels. They have print, large print, they have photos, and it's interactive for caregivers and for patients. So they go over all the basic things with you. The patients get to keep these, or the caregiver gets to keep these. So they're tools for you to always have, but they explain things from transfers to getting in and out of bed, for dressing, how best to when to help the patient get out of bed, how long they should be in bed, all the great things. So these are very interactive and something that other agencies don't do that makes me very proud to be a part of it. But these are really great tools. So yes, short answer. We do help caregivers or loved ones learn all those skills that we do in the home as well. So you can continue to care for your loved one while we're not there.
That's awesome. Yes, it is exciting. Thank you. Okay, we're gonna make a little transition here. So I've had home health before. How can I identify now that maybe hospice? What is hospice versus what is palliative care? Hear this term. What's the difference and what's right for my situation?
Hello, my name is Heath, and as far as the difference between palliative care and hospice, palliative care is kind of like a hybrid. You're still getting some therapies, and you're allowed to have those as far as that goes, but you're also getting the emotions. So you have like a social worker and a chaplain and those types of resources supported to you as well. Can everyone hear? Is that good? Okay. Yeah. Absolutely. So palliative care is offering that emotional support as well. So it's having that social worker and the chaplain, as well as the therapies involved, so that you have more encompassing care as far as that patient. They're not ready to end their therapies for, let's say, what home health does. So palliative care allows that to happen. Hospice, however, is for those that are no longer seeking what Medicare classifies as aggressive treatment. So aggressive treatment includes all the therapies: speech therapy, physical therapy, occupational therapy, those types of things. So hospice would be providing the skilled nursing, the hospice aid that comes out, hygiene and bathing, and those types of things, social worker, volunteers, and the chaplain.
So if someone thinks they want palliative care, how do they get it? Who do they talk to?
Think to their physician. And they will be ordering it for you. So they'll contact who they're comfortable and used to working.
And would Medicare pay for that?
Yes.
Okay, 100%.
Yes,
Okay, and then hospice as well.
exactly. As well as hospice is also paid for by the VA, Private West TRICARE, all of those. and all of the advantage plans that people have out there, those all, once they go into hospice, revert back to traditional Medicare.
So can you kind of help clarify for us? I think we all we hear the word hospice and we probably all have our own feelings about it, what we've heard before, maybe misconceptions about what it even is. Is it a place? Am I sending my loved one to live somewhere else? Is it in my home? Can you help clarify
Absolutely.
that term?
Hospice is wherever you call home, and we come to you. So whether that's in your home, whether it's an assisted living facility, a memory care unit, wherever you call home, we come to you. And so hospice is for those that are seeing a drastic decline. And that's what Medicare really wants to see. They want to analyze what's happened to you or your loved one in the last 6 months and to see what type of declines are happening there. Now, look at those declines, whether it's a cognitive decline, whether they can't remember as much anymore, or it's something else. Let's say you have a heart disease or lung disease or any of those other comorbidities that are going on. Hospice patients, there's no restrictions as far as driving around and going to, play pickleball or whatever they want to do. They're allowed to go out and live their life. Hospice is about quality of life, not necessarily the quantity of life. We're not seeking out that aggressive treatment, trying to get better, but managing the symptoms the patients are having and making sure that they're as much pain-free as possible. And that's what those nurses are doing in visits each and every week.
So I think representative that talks to me and says, you can call us 24/7, you've got our nurse and social worker and this whole team for you. Oh, great. Does that mean just have a nurse help me or my loved one in the home 24/7?
No, unfortunately not. But pretty sure. So no, our nurse comes out whenever needed, and that is 24/7. So if you call us at 3 a.m. and said, my loved one, they're not understanding, they're not settling down. And so our nurse is going to get on the phone with you and go over the types of medications that might be able to help. Or if things are not just working out, our nurse is going to come right on out. So they'll be there within an hour to start helping that person. And how long that they're going to stay there? They're going to stay there as long as it takes, up to 8 hours, to get that person to be adjusted. Thank you. to be settled back down. And whenever we're there for extended periods of time, we call that crisis care. And so we're able to be there for longer periods of time. And if there's just above and beyond, we have always felt that we can treat everybody in their home. And there's no need to go back to the hospital and to the ER. And so we are the new 911 for that patient, that family. So that's what we are. We're replacing that 911 so that they don't have to go through those ordeals anymore of those emergency visits.
Wonderful. So to kind of add to that, if you can't just call your nurse, the nurse isn't going to be there for 4 hours at a time. Oh, well, now my loved one has hospice. We've got everything taken care of in the home. If you do find there's still a gap in care, the person lives alone, or you're just exhausted, you still need to go into work, or you have your own obligations and you need that extra support. Of course, if you're in a senior living, you may have some staff there to help you. You also would have your hospice staff. And if there's still a gap, you might need home care as well. So we find we have a lot of hospice patients where, yes, their medical needs are being met by the hospice agency, but now they still need that extra hands-on help with the activities of daily living. So that's when you would need to hire by the hour, a caregiver to come in and help fill in that gap. What if the in-home setting isn't appropriate for my situation and it's not necessarily my home and senior living? Can you kind of explain the inpatient hospice options that we have in the area, or like going to a skilled nursing facility and being on hospice?
Yeah, as far as Medicare doesn't pay for those types of as far as like skilled nursing facilities, so they will for a certain number of days. as far as that goes, but generally we can treat the patient in their home. That's what we prefer to. If there's something above and beyond that, we do have something called general inpatient that we have contracts with organizations around the area so that we can get the individual so that they're back to their normal status so we can get them back home. That would entail sort of 24-hour care of sorts as far as that goes, but it's not for very long periods of time.
Okay. So as you can see, we have kind of these different care partners. We each kind of have our own little niche. Many of us are going to all provide care for the same individual in different capacities. Maybe someone has one or two or all with the same goal, right? Providing the best care for that individual. What do they need? What is the right fit for them to help them meet their goals? So I want to open it up for general questions. If you have questions overall, if you have a specific individual person you have a question for, just raise your hand. Call on you. Yes, you, sir.
Let me go after tonight and do this one. Man, a white thing. Okay. Okay, let's see. Who had the question? Here we go. Oh, real close up.
I heard an insurance policy, what? For end of life care?
Are you to a long-term care policy?
Yes.
Yes.
Are we still getting?
We're getting a lot of feedback.
Yeah.
We've lost all sound.
So both can provide care to, typically there's two stipulations. There is usually what they call an exclusionary period. 90 days, you have to be paying for care before the insurance policy will kick in. Also, you can use it for home care provider, or you can use it for a senior living. But some stipulations are involved in that as well. Typically, most long-term care policies will require that you meet 2 out of either 5 or 6, what we call activities of daily living. Dressing and grooming, brushing your teeth, getting your clothes on, donning and doffing shoes, toileting, getting to the bathroom, taking down clothes, putting clothes back on and doing that safely. Showering, which is getting in and out, washing all the parts and getting back out and dried off. Transfers, in and out of bed, on and off of the toilet, in and out of the shower, in and out of a wheelchair. Those are transfers. And then eating independently. If we can do that ourselves, or if we need someone to actually do what we call hand under hand to assist you with eating. Some of our long-term care policies also include as a 6th activity of daily living, medication management. So if you meet 2 of those requirements, typically you can file a claim with the long-term care policy and it will begin either. Actually, the home care agency would file those on your behalf and then you get the check, or the senior living community can file those and you get the check. You would just need to pay the bill when it comes. Did that answer? All right.
Awesome. Oh, gosh, Sarah, that's super. Okay, any other questions out there? I mean, usually everybody has questions about these issues that come up and they ask me, I don't know, but boy, we got a team of experts right here that do. Okay, Judy, be real close.
Concerning home health. Okay, concerning home health. When you talk about OT, PT. Speech and a nurse. Do you take, I mean, do all four? Are all four involved, or can you pick and choose, or how does that go?
So it depends on what the doctor orders. They might order all the disciplines or they might not. Sometimes we do have doctors who will say, hey, my patient had a fall, so we want PT and OT in there. But we also notice that there's some cognition stuff going on, so can we get speech out? And we'll say, okay, we call the patient and they say, you know what? I don't have any problem putting on my clothes. I don't have any problem getting out of the shower. I just get exhausted quickly, forgetting stuff. I don't want occupational therapy. And so we'll say, okay, we technically have to follow the orders from the doctor, but understood. And then our PT will go out, do an evaluation, say there's no need for a skilled OT. So we just let the doctor know patient doesn't want that service. But it's available if they just change their mind later down the road or anything. So no, you do not have to have all the disciplines. It again is a discussion between you and your evaluating clinician, and then your doctor as well.
Oh, great question, great answer. Okay, Barb?
So if a person had a chronic pain and has had some declining either physically or cognitively, would hospice be more appropriate than palliative care? From my understanding, you said palliative care was the emotional support added to the therapies that we just talked about. So
Certainly. So whenever you're ready to stop with the therapies, that's when hospice is then a discussion as far as that goes. We're gonna sit down and have a goals of care conversation of what's going on with the loved one to see if they qualify under what Medicare guidelines are, and then assess whether they meet those guidelines as far as that goes. But first, you have to have be under the philosophy of, I no longer want aggressive treatment. I don't want to go to the ER anymore. I don't want to go to the hospital. I no longer, want to have therapies anymore. I just want to have symptom management, controlling the pain. And we will come out and take care of that. Does that help?
Yeah, we talked earlier, they're not allowed to have any other therapies like speech, occupational, physical. Is that a correct statement?
That is a correct statement. So Medicare won't allow them to be on two different disciplines, but we've had patients that still want to do some physical therapy and things. And so they pay out of pocket for those types of therapies. But Medicare won't allow us to have Medicare pay for the hospice and those therapies at the same time.
Good answer. Go ahead, good. Another comment?
All right. As far as specialists, so we also want to clarify that if you're, let's say, seeing your neurologist and we do bring you on for Parkinson's disease, then you're no longer allowed to see your neurologist any longer as far as hospice goes. It's whatever discipline the specialist falls under. So let's say we bring them on for CHF. Well, then they can no longer see their cardiologist any longer. They can still see their PCP, they can still see their neurologist, all that type of stuff. But the specialist that the diagnosis falls under, their Medicare that no longer allows them to see that type of specialist any longer.
All right. How about any other questions that we might have? Oh, okay, here's one. All righty.
This one is in particular to Sarah. Your title here says Senior Living Advisor. So are you available so I could make an appointment with you and sit down and discuss things with you, like what my options are? Yes. You've been very long-winded. I thought I'd give you one simple answer. Is there a charge for our first conversation? You call me, we talk through, can we even help you? Or am I simply going to say, hey, one of these folks is your better option? I'm gonna hand you their name and their telephone number. Call me back at any time. That's complimentary.
So consultation, a free consult.
Yeah. If we decide to go any further, it's a couple of different ways my service gets paid for.
And by the way, in the handout, you have their websites also, and it's also in, on our actual website, GAP's website.
This question is also for Sarah. The prices that you were quoting for the prices. Just a single person, but if you have assisted or independent, those prices quoted per person or per?
Those, that's a loaded question. Typically, we want to say single person. So if we have a couple that are going together in the same apartment, then typically what we want to look at for 55 independent living or assisted living, you have a room rate. And if there is a couple or a spouse or a mate coming with them, there is what we call a second person fee. That's somewhere between $500 and $1,000. And simply what that pays for is extra food. Yeah, a month. Yeah, so it's room rate plus second person fee if you're going together.
Thank you. Hey, I'm curious to, Deb, do we have any questions from Zoom?
Not at this time.
That's cool. Remember, y'all can always ask questions by, in the Zoom audience by doing the chat or by kind of waving at Deb or letting her know, raising your hand that you want to speak. Okay, any other questions here? No? All right, I tell you what, you guys were awesome. Awesome. And I think Stephanie would be a great, MC and maybe, Stephanie, I always say Stephanie, I don't know why, Stacy, I know better. Stacy would be great. I don't know why I always say Stephanie. Stacy would be great. You know, she'd be a good facilitator over here. Thank you, Stacy, very, very much. Thank you, Sarah, Amy, Heath. Thank you guys very, very much. We appreciate it. They're going to be around. So feel free to ask them some questions. And I'm going to come back over here and I'll let Stan get the camera here. Come back to our share screen where we are. Thank you. This is just a really big thank you, Sam. I tell you, we appreciate it. And again, this was recorded so that you can always view this again if you wish. The next thing I want to be sure and share with you, of course, is our mantra, which I already told you about. We still have that. And I want to talk about exercise specifically. Okay. I want to talk about exercise specifically. And we have gardenia. Isn't it a cool name, gardenia? I like that. Mama must like the flower, huh? Anyway, gardenia is going to talk about powerful Parkinson's. As you can see, I've got it down. It's also starting to lose. Yeah, we might have to get some more batteries. But anyway, I have this on our website. We have our phone number. We have the website address. And always feel free to contact them. They offer YouTube videos, live classes. I'll let her go on and explain it totally. So would you like to come on? And you're going to hold it real close to yourself right here. And then we're going to do a little exercise.
Can you guys hear me if I talk like this? Or is it better?
Right up close.
Is this better? Can you hear me better? Okay, definitely. It's a great one. Alrighty. Hi, everyone. I am the program manager at Parkinson's. So for those of you who don't know what Powerful Parkinson's is, we are a nonprofit organization. All of our services are free, and what we do is we do health and wellness and free fitness classes. So they're symptom focused exercise classes. They're really fun,
really engaging, and they're intended to just help everybody find joy in movement. So what we're gonna do today is we're gonna do a little movement break / fitness sampler of what our Parkinson's classes are like. I got two. This is dangerous. All right, so we're gonna do a little fitness sample in just a moment. I just want to share a little bit more about where you can find us and how you can get involved in Power of Parkinson's. Thank you. You guys are so supportive. So we are in Austin, from South Austin up into Round Rock. So we have about 10 class locations, and we do classes all week long. We have classes like seated group exercise classes with standing portions. We have a ping pong Parkinson's class with this amazing ping pong instructor. We have dance exercise classes if you really like moving and to music. It's kind of, we call it rhythm and moves. But we have singing classes if you want to work on your vocal strength, and if you just want to jam out with some people and karaoke it up a little bit. So we have all these different types of ways you can just help manage symptoms of Parkinson's while also having fun and moving and exercising, because we all know how important exercise is and how hard it is to sometimes get yourself to exercise. So with that being said, I'm going to force you all to exercise. It's going to be so fun. And we have no choice because you're here and I have the microphone. So it's great. So I am going to get on the stage and we're going to do it all seated. However, if it is possible for you to try to either get in a chair if you're sitting next to someone, for you to try to get into slide over to give yourself a little more space to move. That might be easier. If that's just not an option, that's okay. Just be wary of people around you and don't go smacking other people. So let me jump up here. And then just be here. By the way, I'm going to be sure to remind you, be sure you pick up the handout. It's got the agenda for the whole year of all of our speakers. And on the back side, we have, again, that free luncheon. It'll be great to go to it. We're trying to get this started, so we have a good turnout. We're going to keep it up, and we're going to have different speakers from the different medications. So this would be really, really good, but I hope you guys do come to this one. Oh, goodness, she's all ready.
This is gonna be a little tougher to be close to. So there's a lot.
Okay, we got you right there. Okay, let's check it out. Okay, are we ready to move? Please say yes. So for those of you who, I don't think I introduced myself. So I'm Garden. I'm the program manager at Power of Parkinson's. So we have a group of the most amazing instructors, and they are so vibrant, and they have years, I'm telling you, decades of talent and skills and working as fitness instructors in the health and fitness community. And they're just amazing with group classes. They really are the best. If you find us on YouTube, you'll see them. They're amazing. I am not one of those. I am a nerd, and I'm more administration background. So I'm not an instructor. However, I have Power of Parkinson's certification because I've worked with my instructors. So just know, this isn't a representation for how amazing our instructors are. This is just, you're stuck with me, but it's going to be fun anyways. So we're going to get started. I'm going to put this on here. Okay, and I'm going to do my very best to be as loud as possible and as close to this as possible, but I also don't want to knock it over with all my moving. So sorry, I'm going to yell. So if we have some room to move, I might just actually yell. Okay, great. Well, I'm giving you vocal strength today, and I'm going to project, and I want you to just yell back at me. So I want everybody to use their vocal strength, which is a component we use in all of our classes. All of our classes have movement and vocal power and range of motion and
to the features. So today we're going to do a few samplers of some of the exercises we include in our classes, and they're all symptom focused. So they are going to challenge symptoms like gait and even hand dexterity. Just making sure that we can manage these symptoms through exercise. So we're going to begin. We're going to start by warming up our hands and wrist and fingers. So everybody get those hands straight in front of you. Again, don't smack anyone unless they deserve it. But we are going to start them say, oh, and get some. Very good. Now, please be proud. Keep moving. So you better be doing it. All right, next we're just go ahead and have our hands up. And shake this out. Yeah. Good. All right, so next we are going to start warming up our legs. Are you ready? So we are going to start with touching our heel and extending our foot, and then touch. So it's a toe tap here and a heel tap here. So we're going to go ahead and toe, heel, toe, heel. Let me hear your toe. Heel, toe, heel. So switch legs. We're going to heel, toe, heel. Alternate. So we're going to go heel, toe, switch, heel, toe, heel, toe, switch. Take it back. Heel, heel, toe. Just be with it. Heel, toe, wow, so you can take a little body. It's just going to get more challenging. It's fun and Power for Parkinson's. So we are going to get our fluidity going on, especially in this sport where we really need some stability for our and just in general to kind of have a stable center of gravity. So we're going to start by twisting to the right. So everybody have our hands. We're going to twist to the right. Center. We're going to go up. Ooh, gotcha. I tricked you all. Then to the left. Then center. Up. Down. Twist. Good job. Up. Down. Twist. Up. Down. Great. Then twist. Up. Down. Twist. I can't hear any. Up. Down. Twist. Exercise for the sample class. So if you need a little bit more, take a sip. If you don't, let's
This is gonna be really helpful to connect these new neural pathways that we're gonna be using, working our coordination and just making sure that brain and body are talking to each other. You guys ready? It's gonna be a little more challenging for that brain. So if you see any of the smoke coming out of my head, that's healthy. So we are gonna start, we're gonna open up our base just a little bit to really get a strong stick. I would say we don't have a mistake. So. We're gonna. So. Let's see. Yeah. Go for it. All right, so that's one. Okay, because you don't even notice you're like lifting, and these are like normal. Over time, they might get a little hard stepping in and out of the shower or stepping in and out of the car. So exercises like these are gonna help you. And straighten happen from a fitness class. But that's what exercise is for, to get stronger, and that's what we're here for. So next exercise. So what we're gonna do is we're gonna go head, legs, and I want you to lift and tap your ankle in the other side. Opposite hands and legs. What this is doing is we're crossing this midline. What crossing the midline does for us is your right side of the body controls your left side. I'm sorry, your right brain controls your left side of the body, and vice versa. So when your mind sees you crossing, not only is it like firing all these connections and telling your brain, hey, your body's moving, but it really just helps you just bring your wit back. So it helps you get back into that keen sense. So are you guys ready to do head, legs, tap, tap, good job. Tap. Yeah. Two. Hey, great work, everyone. These are terrific for you guys. You're too good. We are going to do another. So we're going to start by lifting our same time. So we are going to open up here, really big, large movement here. Make sure that range of motion is going, and then switch to the other side. This is like a year-long vendetta. All right. Great work, great work. Open, great. Awesome. So to make it even more fun, we are going to just say A, B, C, D. One more time. A, B, C. Next exercise is going to be lifting our knees up and our hands. So we are reaching up while our knee comes up. So we are going up, down, up, down. Switch the leg up, down, alternate up. All right. Two more. One, two, three. Doing pretty good. So these are two different directions. So now we're both together. We're going to do A, B, C, D, followed by 1, 2, 3, 4. Guys got it? So all of us together. We're going to be changing direction, using our body, and also just sweating and working out. Okay? Guys got this? Let's go ahead and open up Sweating. We're getting younger by the second. All right, so we're going to switch to our very last exercise. This is a pattern challenge. So everything we've been adding some pattern, some movement. This is a little bit easier. We're not going to sweat as much, but you really got to think about it, and it's going to work your memory. So we're going to start with crossing on our legs, then tapping. Great. Followed by a clap. Stop. Does anybody know what I'm not? I'm just kidding. Okay, so we are going to snap, pull, okay, pull. Yes, cross, tap, pull, down. We started getting cross. Cross. Being breathing, but this is just an exercise step of what powerful part. You guys can't find, I get to use this again. Hello. Okay, you guys can find us on powerforparkinsons.org. That'll teach you, that'll be our website where you can find our events page. We have so many events coming up, like our birthday bash, because we have been around for 10 years. So if you want to join our decade celebration, our birthday bash, that's in Austin on April 15th. It's coming up. You can sign up on our newsletter. If you just go to powerforparkinsons.org, you'll find us. And you can join that celebration. It's going to be dinner, dancing, free, and it's going to be at the Asian American Resource Center. So if you want to find events, go to our website. If you want to find classes, you can also find them on our website. All of our classes are in the Austin area. The northern one we have right now is in Round Rock, but Miss Mary Jane is helping us find a Georgetown location. So we are coming to you. Whether you like it or not, we are coming for you. We're gonna move, and we're just gonna keep sweating because it's amazing. I mean, I feel better after moving. I don't know, you guys. Because I was very nervous before this. So you can find us there. If you guys like doing at-home workouts, please take a look at our YouTube channel. It has almost, I think it has over 1,000 videos. You can go onto that. You can find different class formats. Some of them use props like a ball, or some props that you have lying around at home, like a broom or a pillow. So if you want to do some at-home workouts with us, find us on YouTube, type in Power for Parkinson's, and you will find us. You'll find so many different classes. Some are 45 minutes long, some are 10-minute, just quick movement classes. But you have so many options when it comes to what kind of workout works for you. So just peruse, and if you ever have any questions, you can go ahead and just call us. Our number's on our website. There are flyers at the very back by those awesome red poster boards. You can pick one up. It's got our brochure with all of our information, and then a little flyer for our YouTube channel if you want to work out from home until we make our way to you. But yeah, great work, everyone. You guys killed the challenges. Great job.
We have a question for you from the Zoom crowd.
Yes, questions. Hi, Zoom crowd.
Hi, are any of your exercise classes broadcast live on Zoom or are they all pre-recorded on YouTube?
A wonderful question. Shame on me for not sharing that in advance, but thank you for asking. We have live broadcasted classes. You can join on YouTube. So Mondays, Tuesdays, and at 1 p.m. Central, we have brand new premiered classes where you can jump on this live chat feature and you can exercise and check in and let us know you're there, you're at home and you're working out with us. You can say hi to other people from all around the world and get your workout in while also making friends. So if you guys ever want to jump on one of those classes, it's Monday, Tuesday, Thursday at 1 o'clock Central. And they're very fun. We have different formats. We have Brain and Body on Mondays, Move and Shout on Tuesdays, and Strength and Balance on Thursdays. So again, if you sign up for our newsletters, you'll get all of the information every week saying, here's the link for this class, join us. And that kind of helps keep you accountable and you get your workout in. So you guys can find us there. Do you have any more questions? Okay, we also have on our YouTube exercise classes, of course, but we have a Powerful People series where we interview amazing advocates and community members in the Parkinson's community. We just did one with Dr. Eric Cross. We have one with Dr. Elizabeth Peckham. If any of you guys recognize her, she's amazing, fantastic. So you can, I mean, the one we just did, we were talking about non-motor symptoms of Parkinson's, and it's really fun. So you can find so many things on our YouTube and so much about Parkinson's and just Parkinson's resources. Again, we are completely free, so take advantage of us. So yeah, thank you for having me.
I'll tell you, she is awesome. Awesome. We did take a class together and you did a fabulous job. She was a little concerned since she wasn't the exercise instructor, but oh my gosh, she did so good. Thank you. And we advertise for Power for Parkinson's on our website, also my emails. And yes, it's super. It'll also be on my Facebook account, as well as the newsletter, Dr. Krause's upcoming presentation. Well, he's already had it, but it's recorded presentation. So it's great. Thank you, Dr. Gardenia. Thank you. And she'll be here near her brochure, so feel free to go over there and ask her any questions. Oh, okay. Now? Okay, can y'all hear me still? We're just checking all of our mics. Okay, I am going now. It's almost time for our door prizes. So yes. You want to do that for sure. Okay. Okay, so the door prize. So get your tickets ready. I do want to tell you though that all of you have a chance to be a winner. If you look back there is some gray packages and some pink packages. Don is being our Vanna White and showing everybody. And there is a walker back there. Vanna is showing you. It's all free. It's all free. So those are extra large depends, and they are the pads. And if you know someone that needs them or would like to have them, please take them. If not, I will be just giving them all away. So please, and then there's a walker. Oh, goodness, a walker also. All right, now with your ticket. And what are we giving away for the first gift? Who's got the first gift? Okay, we got something really cool back there. Is that the one that's given by Lacey at Care Patrol? Okay, Lacey, come on up here and we'll let you draw that number. And she has made a donation for us and we appreciate that very, very much. And this is for, what is it exactly? It's a blanket. All right, you'll want this. Get your numbers ready. And yes, this is open to the students too. I hope you guys got your numbers too. Okay, and the number is
662282.
so the last three. We got a winner, Okay, what's the next gift? Carol, what's the next one? Oh, we got it's a cane. Does anybody need a cane? Okay, the number is 325. Oh, All right, I got that. Well, there you go, there you go. Okay, the next item. Okay, those are a set of 4 glasses with straws that are pretty cool. They're really pretty. Okay. $2.99. $2.99. We got some. And okay, she's gonna bring it right to you. Okay, what else do we have back there? Boxing gloves. Is anybody in 413 boxing? All right, those are women's. There are some women boxing gloves for your quarterman.
And there's some, those are men's, the red men.
Reds are men, and what color are your blue? Your
Black.
black. Okay, so this is, huh? All right, now, which are we going first? The black ones or the red ones? You get, yeah, go see the winner, gets to pick it. Okay,
Okay, 293.
293. Do we have a 293?
Yes, but I would like to be gifted.
Okay, we got Marie gifted, okay? Means you got another chance, guys.
280.
You can go back and you can pick if you want the guys or the gals. Okay.
I'm still here still.
306.
There's one of our students and they're gonna be boxing when they come in and say, okay, it's time to get down. Okay, do we have any gifts back there?
What is it here? Oh, that goes with the wheelchair.
Okay.
I mean, the walker.
Yeah, so remember that if anybody needs a walker, please grab that walker. And again, if you need any of the extra large pens, grab them, or the underpad, grab them. And if you need more, let me know. I've got a lot more at my house. So when people make donations to me, I just turn around and bring it here. So feel free to take it. But now here's another part of exercise. And the ones that come here all the time know about this one. The ones that are new today, going like, what? Okay, we need for you to help put up your chairs and help us put up the tables. And so you'll be doing that, but I want to be sure to remind you, next month's meeting is March. It'll be March 23rd. It'll be Josie Zamora and Teresa Shapiro. Teresa Shapiro is a lawyer. It's going to be really, really good. It'll be care partner to care management and elder law. So this is a perfect time to answer, or if you have any questions on this, to be sure to come to this one. And then we'll get back into the medical part. Anyway, thank you all for coming. Thank you for the students. Thank you for our wonderful presenters. Oh my gosh. Thank you. Great job. And thank y'all for helping us put up all of these chairs and tables. Thank you. Okay, bye now. Bye Zoom crowd. Thank you, Deb, for all you did. Thank you.